Good morning, everyone, and welcome to our discussion, Leadership in the New Normal, Business Leaders Respond to COVID-19. My name's Kevin Klowden. I'm Executive Director of the Center for Regional Economics at the Milken Institute, and I'm moderating today's great session. Before we start, I would like to take a moment to remind everyone that this call is being video recorded. It will be made available online tomorrow. Questions can be submitted in the bottom right corner of the screen through the question and answer feature. Please feel free to go ahead and use that. As we've been doing these sessions each week, we've had a diverse group of leaders exploring a different aspect of the coronavirus challenge and who have outlined creative and shared solutions that can activate the Milken Institute network for positive impact in response to this pandemic. We've had a number of previous calls that have covered topics from vaccine development to strategic philanthropy to market implications of the coronavirus. We have a number of future calls in development, which will include areas such as discussions in Asia, focuses on mental health, the role of media, long-term care, various other scientific and social and economic challenges. But today we are focused specifically on the leadership in the new normal. In particular, we have an excellent panel with three marvelous panelists. They include Jane Fraser, President of Citigroup and CEO of the Citigroup's Global Consumer Banking, Barbara Humpton, President and CEO of Siemens Corporation, Siemens USA, and Mike Milken, who is chairman of the Milken Institute and Faster Cures, among numerous other titles. Today, what we will be doing is we will be having Q&A late in the session. So I just want to remind everybody, please, to submit your questions now so we'll have a chance to get to them later. At the moment, I would like to go ahead and start our discussion. I will start with an opening question for Barbara. And Barbara, Siemens is one of the world's largest and most diverse companies. How have you been responding to this crisis, which has affected our economy in numerous and a variety of different ways and created a number of challenges in terms of workforce, in terms of infrastructure, in terms of cash flow, in terms of confidence? And how has the international aspects of Siemens helped your decisions here in America?
Kevin, thanks. I really appreciate the opportunity to be with you all here today and talk about this. We're in the midst of this and we're learning from each other. At Siemens, we think of ourselves as a business to society company. You've heard B2B, you've heard B2C. We're a B2S company. And this is maybe more important now than it's ever been. We've got 50,000 employees across the U.S., and we've got experts in electrification, automation, digitalization. These are skills that make us absolutely vital to the nation while we're in the midst of the crisis. And what we're finding is that we've taken 4 key priorities, and that's really set the framework for how we behave as a company right now. The first 2 go hand in hand. It's first, let's make sure that we're taking care of the health and safety of our employees. And second, let's make sure that we have a good handle on business continuity. I mean, we have to take care of ourselves, take care of the business so that we can serve others. Well, the third priority has been to figure out how our know-how can be leveraged to support the many challenges our society is facing right now. And I'll give you some examples of that. But fourth is one which is really kind of inspiring all of us, and that is, how do we look ahead? How do we determine how we can help make the future more resilient? Now, when we've thought about what we have, just in our own cupboard, our own capabilities to help others, what's been clear is that our expertise in healthcare has been essential in assuring that we help hospitals expand capacity and have the equipment they need to serve patients. And then we've actually had know-how in building infrastructure that has been brought to bear to help customers like the state of New York expand their hospital capacity itself. We've also turned our experts in manufacturing toward the challenge of making sure manufacturers across the country are able to increase their efficiency, maybe produce things they've never produced before. really every part of the corporation is helping. We found ways to turn our charitable donations toward public health centers, community health centers across the country. And we even have employees engaging in their own way, finding ways to do things like use their own 3D printers to create PPE for local hospitals. So this has really been a whole of corporation response. One final note, Kevin, you asked about, what's the effect of being a global organization at a time like this? Well, we have truly been learning a lot from our colleagues. Our China colleagues were the first, obviously, to experience the shutdown. And just as we were beginning to experience outbreaks in the US, that's when China was coming back online. So we've got regular sharing opportunities. Just this morning, I was on the phone with the CEOs of China, India, Germany, and many of the corporate functions and businesses operating at a global level, keeping track of open operations and the actions we need to take care of our employees and ensure our facilities open back up.
Wonderful. And it's great to hear that you're coordinating and still in such an international level, given the number of barriers that previously people would have thought would have made it so difficult. And this modern technological world is certainly creating some robustness and ability to navigate through in a way we couldn't have imagined a couple decades ago. All right, my next question is for Jane Fraser. One of the most profound and unprecedented aspects of the COVID-19 induced crisis is the fact that it forced a dramatic reshuffling and tremendous changes in capacity and focus in a very short time. Nobody was particularly more affected by this in terms of a public viewpoint standpoint at the beginning of this than the banking sector, because with the dramatic closure of the U.S. economy, this not only created tremendous logistical challenges for Citi, both as a corporation, but also as a lender. What key steps were needed to be taken to quickly adapt to the needs of both employees and clients? And how did you manage, and what kind of lessons did you learn along the way?
Well, thank you very much indeed, Kevin, for inviting me along for this one. A fabulous group of people to be part of with Mike and Barbara. And I think many of the things Barbara is talking about, I'm sitting listening to her, are resonating tremendously with our own experience, particularly, I think, the spirit of collaboration, the focus around communities for employees. And I was just reflecting, it's day 100 since we set up our crisis management team in Asia. As you say, it's remarkable, I think, how much most companies have transformed how they work, and for us as well, how people bank around the world. And from the very get-go, Mike Corbat, our CEO, was very clear: 3 priorities: protect employees, protect clients, and protect the firm. And above all, get ahead of this. And I think, similar to Barbara, the benefit of having a very significant footprint in Asia was we learned a tremendous amount in that first month from them, both in terms of the type of relief that consumers needed and what their concerns were, the same with corporates. We got a good sense around what some of the employee concerns would be, and as well as some of the physical changes that we were needing to our operating model. Banking has the benefit of being an essential service, so from the respect that gave us more flexibility. But it was clear, looking at operations in Italy and Asia, we had to get remote very, very quickly, so the fear factor from employees didn't come in and affect our capacity. And so we very quickly had our remote access go from 35,000 employees concurrently, was the peak we'd ever had before. Today we run at about 130,000 concurrently with a capacity for 220,000. So that was one of the huge pieces. The second piece was innovating jobs that you always used to think you had to do in an office or in a site, and getting them rethought as being work from home. And today we are working, 70% of our people work remotely from home. That varies a bit by different geographies. So in Asia Pac, it's a lower number as opposed to the US. Outside our branch network, it's 90% of our employees are working from home right now. And our head office, which is a little bit in the peak of the storm, we had 40 people walk through the turnstiles the other day. We managed to close the bank's books a day early without a single individual being globally, without a single individual being in the office, and we did so a day early. So I think we've gained in confidence that we can operate the bank extremely effectively with high productivity without anyone actually physically being in the office. The other critical piece has obviously been ensuring that the bank is able to do its day job, and that's making sure that we're there for our clients. And that, in retrospect, a lot of the actions that were taken from the last crisis have made sure the banking system has the capital, has the liquidity to then be able to focus on supporting clients. And I think all kudos to the Fed for the actions they've done of making sure market structures are in place and that the stimulus and actions are there so that we've been able to focus on clients and not worrying about the functioning of the markets because they've done such a great job. And from our client perspective, a huge shift in the business model. So no one really wants to walk into a branch today unless they absolutely have to. No one wants to go and get dirty cash out of an ATM if they have to. There's been a big pivot to digital. But at the same time, they want a human touch. They want someone to talk to. So I want some things to be quick. If I need relief on my debt payments, I want to be able to do that digitally and quickly, but I still want advice. And so it's this interesting mixture of high tech and high touch, and still having a soul that's very important for the consumer clients. And on the corporate side, I think there was an enormous amount of work focused on helping companies access capital, addressing big disruptions in the supply chains. Some of the operational considerations have been very important. Cyber was a worry, although apparently it looks like that cyber is not such a big issue at the moment. It's more the amateurs out and potentially some of the state-sponsored cyber, but they don't seem to be going to the office these days. So it's been relievingly quiet on that front. So a lot of changes in this sort of setup, but I think our and many of our peers' ability to go remote quickly and therefore be able to focus on the clients and have the markets operating reasonably well, and for us to focus on our day job has been very important. I think the industry's done a good job on that.
Wonderful to hear. Now, thank you very much. And now I was going to round things out. My next question is to Mike Milken. And with all the focus, Mike, on unemployment numbers, including another over 3 million declared this past week, and the tremendous capital crunch that has been facing the economy, what are the positive stories that can be found in how America has responded to both the original virus and the virus itself, SARS-CoV-2, and the resulting disease, COVID-19? How can these positive stories inform our actions and strategies going forward?
Thank you, Kevin, and it's great to be with you and Jane and Barbara this morning. There are numerous positives, and many things have been done over the past decades that have prepared us for those positives. First, the government response. We have a crisis that was not brought on by excess financial leverage in our financial institutions. As Jane could tell you, Citibank was probably in the best shape ever in the history of their company. It was been brought on by a medical crisis, a virus that travels the world and reminds us that we're all on this little planet, this little blue and green planet that is unique in the solar system. And we would have to travel light years with the hope of searching for another one, and how important it is for us to protect us. So what is working? The internet is working. Fast speeds, allowing us to speak to each other around the world. Financial firms, and beginning in February, I had suggested to a number of the financial firms that they should have 25% of their employees working from home as a test, just in case they needed to. Then alter those 25 so everyone has the experience of working at home, then to go to 50, etc. And the financial system is working today, providing capital. Markets are functioning as they should. Power. And thank you, Barbara, for your support. The lights are on. People have access to power. They're not worried about blackouts. They can turn on their computers, etc. So that is working. Our medical research system is working. And the enormous investment that had been made in this system with efforts that we had done in the 70s, 80s, and 90s has paid off with a situation where we had on January the molecular makeup of this virus distributed to anyone in the world that wanted to work on it. And 63 days later, on March 16th, the first vaccine against the virus was put into a human being. 9 weeks, not 9 years, 9 weeks. There are more than 200 vaccines, antivirals, etc., and the entire bioscience industry, for-profit, non-profit, pharmaceutical, biotech, and other related companies have responded. Many companies have waived patents, gone into partnership. An example can be seen where AstraZeneca has agreed to manufacture, accelerate, and produce the vaccine from Oxford University that looks positive from this standpoint. Government and private industry has responded probably better than any time before in history. We would look at World War II to see what's occurred, but today private industry is much more diverse and capable of doing things with technology it wasn't able to do then. And so the movement between BARDA, the movement between NIH, FDA, VA coordination today is extreme. Testing. The response of our major retailers to provide testing on their premises is unprecedented today, and the cooperation of our large companies. Almost a third of America visits a Walmart store every week. Kroger has 11 million Americans that go into their store every week. And so as this extends itself, their participation in this effort, I think it's very important to understand, Kevin, what has changed and what we talk about the new normal. Jane mentioned something called Hightech, hightouch. In a book written in the early 1980s called Megatrends by Yankelovich and Nesbitt, it talked an entire chapter about high-tech, high-touch. And as you deploy more technology, you have to keep a human touch from that standpoint. The ability for all of us to communicate with each other, see each other today is that example. And so dramatic changes have occurred. Healthcare will never be the same. Numerous healthcare providers have more telehealth meetings in a day than they did in all of 2019. That will not return. Interacting with senior citizens that required phone calls or in-house visits, they have learned to communicate increasingly like we have via internet and other interactions. That will not go back. Education. As you know, Kevin, with your own son, he's going to school online at the University of Chicago. Much apologies.
All right.
However, if you go to the podcast that exists in the more than 40 that I've done, you will see that Steve Ballmer, former CEO of Microsoft, largest stockholder, individual stockholder of Microsoft, son was in Australia going to school for his year abroad from the University of Michigan. University of Michigan notified all their students to come back to the United States. So he's now going to school in an Australian university online for credits for the University of Michigan. The world has changed. Healthcare has changed. There are downsides. What's happening to cancer patients and other patients with other life-threatening diseases? Their treatments are delayed. The amount of research going on, and you can hear that in the podcast with Steve Rosenberg from the National Cancer Institute or Nobel Prize winner Jim Allison from MD Anderson. All these patients who's had their immune system compromised have to be separated during this period of time. In the future, we will deal with this differently. The stock market, financial markets have treated companies in much different ways. The bioscience industry, most stocks are trading at their all-time high. Many of them are constantly reporting their all-time highest revenue, free cash flow. Those companies in food distribution, same thing. Stocks near all-time highs, profits near all-time high. Health insurers, because of the cancellation of elective surgery and not going in emergency rooms, their stocks are near all-time high. However, if you were in the hospitality industry, unleveraged, and now they've shut down your restaurant, you've shut down your malls, you've shut down your hotels, you've shut down the airlines, much different story. Not because of something you've done wrong in your business, you've had fundamental changes occur. And it'll be a while before it returns, but each of these hospitality companies will have a chance to redefine themselves and their relationship with their customers. And obviously it starts, as Barbara's pointed out, are their own employees safe and healthy? And can their customers feel safe and healthy? But finance, healthcare, education, in so many industries, we've accelerated the movement online and technology. Lastly, the human tragedy that's being played out every day in the world. A young entrepreneur who's working for his father's company, maybe 2 generations, that had a restaurant. Now he's worried about he can't help others in the community because he can't help or she can't help herself and her family. That is why every day today has to be viewed as 2 weeks. 2 days is a month. It's costing the U.S., in my opinion, $1 trillion a month. It's costing the world maybe $5 trillion. Now, all that's not financial. The U.S. announced that the economy shrunk by 4.8%. So maybe that's $1 trillion for 3 months. It is not documenting human suffering. As you pointed out, Kevin, our session coming up on mental health. Will we have more people commit suicide this year than die from this virus? What has happened to their fundamental belief of what they're capable of doing and their family? Those that felt they were safe might not feel safe. Those that felt they were financially secure might not feel financially secure today going forward. And lastly, I want to come back to the optimistic. The social capital of companies, the social capital of the United States and other countries in the world is alive and well every day with people helping others that are less fortunate. Whether it's a young college student who's home from school that goes out and gets the food for their senior citizen that lives across the street or in the apartment building or next door, who's doing those. Our first responders, healthcare workers knew they were at risk. But what about the checker in a grocery store or the person bagging your groceries who now discovered that they're a first responder? And it was so interesting to see in Oregon, the firemen coming with their fire engines blaring and thank you notices in front of food stores and thanking those workers for coming to work. Lastly, the safety net. The media constantly gives us negative news. But unemployment insurance that's in place for all these people that have filed once they get it, for 70% of those people at least exceeds what they were getting paid. Many employers were worried, would their employees show up to work in grocery stores or other places that have become essential if they could get paid more for not working than working? The answer is they showed up. They've been committed, and the pride of a person who was a bagger in a grocery store that people thought, what a lowly job today, who's carrying those groceries out for a senior citizen, and other people are thanking them as sitting there as first responders, has brought new meaning to every type of job that's interacting with people in our country. And lastly, if we step back and think about what is working, food distribution, deliveries, long-haul trucking, etc. Our challenge going forward is the imbalance right now when we see farmers plowing their crops into the field. We see milk dairy farmers pouring millions of gallons of milk down the drain. We see people raising hogs who now are slaughtering their own hogs because they can't bring it to market. One of the areas that we have to address quickly is food distribution. The U.S. can easily feed everyone in this country and hundreds of millions of people around the world. The risk that we see today in sub-Saharan Africa potentially coming is not only getting the virus, but what's going to happen with food security for them. So there are some things we need to improve on. And lastly, I would say the response between the individual, the company, and the government, to me, is greater than ever before. Barbara's talked about using 3D printers. There's biological 3D printers today and regular 3D printers. We're going to speed the whole concept of sending a program to your 3D printer. How do you print it? And lastly, I would say in this area, testing. I would expect in the next 30 days that we will solve the testing and the accuracy of testing. I would expect that we will move to excess in ventilators, masks, and other PPE equipment as everyone responds. And I would expect by the end of May, the U.S. will become an exporter to other parts of the world, particularly the developing part of the world, where they might be experiencing shortages once we have gotten manufacturing up to date. So I see rays of hope every single day, and we have a question. We need to continue to analyze what has gone on in Sweden and how many people should be sequestered. Should senior citizens like myself and my wife Lori and very young children and people with preconditions be sequestered? And should we let the vast majority of the population attempt to return to, Kevin, what you call the new normal?
Thank you, Mike. At this moment, I will just take one moment to remind everyone about the Q&A feature and note that if you wish to have your question read at the end of this session, please go ahead and submit it now. We are still planning to have about 10-15 minutes of Q&A at the end. Now, building off, Mike, what you said, I'd like to turn things back to Barbara. Barbara, in particular, we're dealing with the fact that the essential infrastructure of the United States has had to adapt to this crisis, but we have a number of additional potential crises, ones that we've faced in the past and will face in the future in terms of effects of climate change, various other kinds of disruptions, potential new pandemics. How do we adapt and learn the lessons of COVID-19 to those potential immediately upcoming crises and other ones? How do we stockpile, take what Mike referred to as this potential surplus and put it to use, as well as adapt our structures otherwise?
Yeah, this is a great question and something that we're actually actively working on. In this morning's global call, one of the things we talked about is the fact that the North Atlantic storm systems are going to start to fire up in just a couple of months. And the data is telling us that the Americas are likely to be hitting a peak of infection rates during our summer months. And of course, we'll be dealing with crises on several fronts. Now, it's possible for us to simply brace for impact and prepare to respond as we always have, or we can really draw in some creative thinking. And let me give you a couple of examples of the kinds of things we're looking at. One, of course, is do we really need to deploy people for all of the actions that are needed to protect our critical infrastructure? An example is our colleagues in Siemens Energy, who are really responsible for keeping the lights on for all the rest of us. What they quickly discovered is that they have new tools in virtual reality that enable us to send maybe a technician or a smaller group of technicians to a utility for their planned power outage and perform maintenance actions there with the virtual help of experts who are at a completely different location. So we can start thinking about this, how to use our high tech to complement the high touch things that are going on throughout our critical systems. Another thing to think about is we know what we need now. And you know, we're awfully good as a society at ramping up rapidly in response to a crisis. And then we have this tendency to continue to fight that last war. What we really need to do right now is expand our thinking. Yes, we're dealing with a pandemic of a respiratory illness. What other things might strike in the future? And are there actions we can be taking now? Here's an idea I've talked about with Mike. What if we could create a strategic digital twin reserve? You might ask, what's a digital twin? Well, you know, we make all kinds of medical devices, pharmaceuticals, devices that are used in every day as we respond to various either health or other crises. What if we had manufacturers actually create a digital version of those products or services that could be archived as an opportunity to then allow us to deploy and scale through other manufacturers, maybe in the midst of a looming crisis? This strategic digital twin reserve would give us access to intellectual property that would help us as we face challenges in the future. I actually think this is an important time for all of us to be engaging in dialogue. You know, the thing we've discovered through this is that we're dependent on each other. There is no such thing as saving the airline industry. We have, in order to save the airline industry, we have to really begin with the flying public and think about all of the systems and the societal impacts that are engaged. And this is one reason I think Jane is in such an interesting position right now, because how capital is deployed right now is going to make a big difference in the strength of critical elements of the highly interdependent economy in which we work. So Kevin, let me leave it at that. I'm sure we'll probably have some questions from the audience, but the big thing is we really need to think broadly, engage with each other to challenge our thinking, and then come up with some critical ideas for the future.
Thank you very much, Barbara. Now, Jane, I'm going to build off of that to direct something your way. Just to expand on what I asked Barbara, and to also refer back to the fact that the United States acted at a federal level, both from the Federal Reserve with the secondary market corporate credit facility and similar actions, as well as the CARES Act that came through Congress. What kind of adaptation needs to be in terms of deploying capital to companies and people, both in the immediate term coming out of this crisis and in lessons in terms of longer term and resiliency?
Yeah, and it's interesting because I think there is a bit of a startling divide between some of the what's happening in the markets and some of the realities on the ground of where people are suffering. Because as Barbara said, don't fight the previous war and the previous crisis. I think the difference of this one is from 10 years ago, it is a healthcare crisis, and until we tackle the healthcare, the actions we take on the financial side are only therapeutic care. So there's a huge amount of focus around how do we look at who are temporarily affected by what's going on, and where are the changes that are going to be more significant. And there is a veritable alphabet soup of different recovery scenarios for different countries. The V, the U, the W, the L, there's a huge variety out there. And which one happens is probably driven by the healthcare response, as well as some of the financial and other resiliency of the countries concerned. So we worry about EM. We worry about, while the elderly have been impacted by the healthcare and some of the minority populations in particular. From the economic point of view, it's been the small businesses, it's been the youth, it's been the minorities. And how do we make sure that we're allocating some of the capital to them? Because as Barbara said, huge interdependencies here. 48% of all American jobs are with small companies. 80% are with small and medium-sized enterprises. So as Mike was talking about, how we get them back to be able to open their doors again, while still being an environment that's safe with testing and the psychological safety as well as the very real health safety being tackled, is going to be fundamental. And the government putting through the small business assistance has been very critical. A very tough program, one that's had some criticisms on the operations, but when we think of the SBA, they will normally distribute $30 billion worth of loans in 1 year. They have had to do 20-fold that number in well under 2 months. So that's a tsunami of aid relief to be distributed at extraordinary levels, and it's been terrific to see the level of cooperation amongst the banks as we all help each other try and administer these government aid programs and get them into the right hands. The same with Paycheck. So really, in some ways, the first piece of capital hasn't been so much the banks, but it's been getting these stimulus checks. It's been getting the aid into the hands of the people who need it the most. And that's been job number one. So let me pause it there.
All right. That sounds wonderful. Thank you very much for that response. And that brings up a broader question in connection with that. Before Mike, I'm going to, Mike, if you would like to, first off, you would like to respond to that, and then I have a broader question to follow up on that, which I'd love your thought on as well as Barbara and Jane, which is in terms of this collaboration with state and local governments over the next 12 to 18 months and what we're looking for there from the private sector.
Kevin, we're all a product of our environment, and this experience will never be forgotten. Those that grew up, my parents, during the Depression and World War II, were dependent on the federal and the government for their survival, whether it was survival in a war or whether it was survival of the Great Depression. This will not be forgotten. So when we talk about the lessons that have been learned, my guess is people will be more conservative in the future. Whether we revert, and when we had our conferences in the Middle East in the early part of February, I put a wristband around my wrist so I wouldn't be rude in not shaking hands, and could convert to touching elbows or bowing in Japan. So I think we're going to have fundamental changes of those that lived through this experience. A 6-year-old that's going to school online or a 7-year-old, and what that has. Families having dinner together as a family, where members of the family were working and doing a lot of traveling. They're spending more time quite often with their children than they would have had normally. What are these relationships going to be like in the future? So the first thing I want to say is that fundamental change is going to occur, and people who've experienced this will view their businesses and activities differently. This runs a risk that people will be more cautious on reopening and opening up their businesses for a while, and we have to find a view on the risk taker. As you know, Kevin, my whole focus in finance was to focus on access to capital to this 80% of the companies that Jane was speaking about. And as I talked to hundreds and hundreds of these companies that I've been involved with over 5 decades, 4 decades, 3, and what's happening them, human tragedy after human tragedy, what's going on with their employees. And their employers have reached out to try to focus on, can they protect their own employees? What about a person that's worked for them for 10 to 20 years now and doesn't have a job and they've shut down, and what's happening to their family? So I think we'll have fundamental change as how we look at the world for this group. Young people are resilient, but people of your age, my age, how we view the world will change. I want to stress again the importance of these changes. It was 6 months ago, we were hearing that the bioscience companies weren't helping our country and were charging too much. Now we are relying on them. You can't not have gone. I don't know how many times I've subjected you to it, Kevin, or Barbara particularly, without hearing in the last 30 years from me that 50% of all economic growth is related to public health and medical research. The greatest achievement of mankind, going from median life expectancy of 31 in 1900 to the mid-70s today. Grandparents spending plenty of time with their grandchildren, great-grandparents spending time with their great-grandchildren was not a story you were reading about. We don't reflect on the fact that 20% of all Americans died before their 5th birthday in 1900. Main causes of death: dysentery, pneumonia, and tuberculosis. Penicillin and other advances changed that world for us. And this science will change the world. We will not let our guard down again. You will have machines that are being developed in technology today that will be able to identify any virus. It might require the changing of a cartridge, but how we sequence and doing these things will change. And the enormous response, we will find a solution to this virus. It might be controlling it through antibodies, immunology, and antivirals before the vaccines are available. But never before in history has the government, in this case the U.S. government and others, agreed to put up money with J&J or Moderna to make a vaccine that we don't know if it works. But if it works, we're not going to wait around for someone to manufacture it. They are being manufactured now. And as Gilead announced this morning, they've already made 50,000 doses of their drug if it is approved to give to people. So we have made the investment. And why are countries investing billions of dollars in products that might not work? Because it's costing our society trillions of dollars. But more than that, it is devastating the lives of hundreds of millions of people. So the cost to society is small. We spend too much time talking about what we didn't do in January, February, or March. We need to focus on what we're going to be doing in May tomorrow. And we'll have plenty of time in history to rewrite the history books and what occurred. But today, the American people and citizens of the world should realize that we are all in. Bioscience is all in. Distributors are all in. Tech is all in. Those that support the cloud are all in. And we will have a solution for this problem in the next couple of months. And when we have that solution, we can then decide how we're going to operate in the future. And my guess is we'll operate with a lot less leverage and a lot more focus on public health and medical research.
Thank you.
Mike, I think you're right. And I think something this crisis has shown us is this relationship. It's a global pandemic. Every human is experiencing this. But at the same time, it's hyper-local. And what we've seen is the importance of state and local governments able to step up and actually address the specific needs of the communities that for which they're responsible. And so a quick example of this is Siemens has developed, our colleagues at Siemens Healthineers have developed a total antibody test. It's now in the process of being reviewed by the FDA. We hope to receive emergency use by the end of May. And we're already meeting with governors and their teams across the country to make sure that they're aware of, familiar with, understand the footprint of lab capability that already exists in their state, so that when the moment comes, we'll be able to serve their public and be able to respond. So I agree with you completely. This is a really eye-watering collaboration between government and the private sector.
Kevin, just as a comment, 40 years ago, 45 years ago, I made sure I listened to every new idea, every new business idea, because business was going to change and the way you did things and the way you solved problems was going to change. And so that young entrepreneur, whoever he might be, Bill McGowan at MCI or John Malone at TCI or Ted Turner, I made sure I listened to their vision of the world. Today at the Milken Institute, as you know, whether it's our Faster Cures or our Centers for Public Health or our Center for Strategic Philanthropy, we have moved in a different direction. We are listening, as Barbara pointed out, to every idea, dozens a day, of how to control this virus. New ideas and testing, as Barbara, we need to make sure people feel comfortable the tests are accurate and they can all reach those tests. So there is no idea on a new antiviral, antibody strategy, vaccine that we aren't listening to and running down, no matter how unusual that idea is. It might be the idea that solves the problem. So my world has shifted, but as Barbara said, we have a lot to learn with many of these new strategies and testing, and I am sure that how we view testing will be substantially different in May than it is today.
Mike, can I pick up on one of the things you were talking about as well, which is the collaboration and some of that spirit of generosity, but how do we apply it to some of the nations that are not going to be in the same position as the States? As a fairly recent immigrant to the States, I love the human capital, the collaboration, the resources and the ability of this country to seize a problem and do the extraordinary is not something that many other countries do. And we have partners, for example, in Mexico that are only putting a stimulus package together that is less than 1% of GDP. As you were talking about, we've got the ability to export masks, we've got the ability to export ideas. I think that same spirit of generosity and compassion that we see in local communities is going to need to be applied once we have our own house sorted and in good shape into many of the emerging markets. And it's an opportunity for the US to demonstrate that generosity of spirit in a very important way that can help our partners around the world who are critical supply chain partners and critical to the States, but also the impact the US has on the world is going to be a very big opportunity for us soon.
Jane, to my knowledge, your financial institution is in more countries than any other financial institution.
98.
And so as we think about this, what has been the Milken Institute response? We've launched the Africa COVID tracker to understand what's going on in Africa, a continent that is expected to be 100% of the increase in the entire population of the world in the balance of this century. Young people, some countries median age is 16 or 17 years old. So they have changed dramatically due to the advances in HIV and AIDS, and the fact you don't pass it on to your child in childbirth, and the control as simple as for some, just a simple pill you take every day. So there is no vaccine for AIDS. And we're now talking 30 to 40 years later, but there is control. And so this search for the vaccine should prove successful with all of our technology for COVID-19, but I am sure we will control it before we have a vaccine. But whether people feel safe with control, we should never forget that Oprah Winfrey went on television in 1987 and told the American public on good information, as many as 20% of everyone in the United States will die of HIV and AIDS in the next 3 years. Obviously, that never occurred. And so my point that I made before is we will have a lot more respect for those going into bioscience. The creation of BARDA and the response of FDA, CDC, CMS, HHS, NIH, and so on, NCI, maybe like it was in the period of time in the 50s, 60s, and 70s when it was cool to be a physicist or a mathematician after Sputnik. It'll be interesting to see, Kevin, whether your son and how many others say, you know, I'm going to go into bioscience. I'm going to work in this field because it's effectively the largest industry and maybe the most important.
Absolutely. Now, I would like to take this moment to feature a couple of questions from the audience that have been submitted. Ironically enough, as everybody's been talking, their panelists have done such a good job, they've actually managed to answer a couple of them in advance. But a couple things I want to double back on. Jane, you mentioned a bit in your comments earlier and would like to take a moment to elaborate on what is Citi doing for its high-risk customers, such as the elderly, who might not have access to online banking and generally rely on physical bank locations. How lasting is this consumer shift to digital, and what can be done for these people?
Yes, it's a very good question, and it's not also the elderly. It is also we've seen it with some of our minority clients. We've seen it with our low-income clients as well. That the access to digital, the access to banking services, the access to many things is not the same that is enjoyed by others. We have kept our branches open because that is where some people who don't have a credit card, are having to come in maybe without a bank account to cash a stimulus check and the like are coming to. And one of the critical pieces, particularly as these are in the centers of cities, where the community spreading of the virus has been significant, is making sure that the basic services are there around hand sanitizers, around social distancing, but also making sure that there's a very warm welcome and that there is, as we talk about, that human touch, that soul, in terms of inviting them into the branches, helping them, showing them how to use their phone to be able to deposit a check, providing them some of the teaching and the education, and doing so with great respect, and making them, not feel in any way that they've been disadvantaged or the lesser for it, but really trying to help and teach them. And we've also been trying to make our digital experiences incredibly simple. So we have 1 million people signed up in the States for our credit card relief program. It took 2 clicks to be able to do so once you'd signed in. 1 click to go to the relief site and 1 click as to which accounts you needed to apply for relief for, and that was it. So I think there's a lot of different things to try and take away some of the challenges that people have that aren't digitally savvy or find financial services intimidating, and to make it as simple and as human as possible, but also as welcoming. And it's going to be tough further on down the road, because there are some people who will be able to bounce back from this, but there are others who are going to need to have more restructuring of their finances, and that's some of the pieces that we're also all of us in the banking industry very mindful of, and learning the lessons from the last great crisis in terms of how do we help people stay in their homes. I think as an industry, we've generally said we're not enacting any foreclosures, any evictions at the moment, because many of the people, as saying before, who've been impacted by this economically, it's not us. It is much more of the vulnerable. It is the lower income. It is the elderly, and we've all got to go out and look at how we help them, and that's a focus from everybody.
Thank you. And Barbara, in terms of adaptation to this new normal, Siemens, because of its important role in having a number of must jobs, what have you been doing to ensure that your on-site technicians who've been able to perform these jobs and must perform these jobs in person are properly screened before returning to work? And how is this whole crisis changing how everyday on-site tasks are performed by these people, and how are you adapting for the future?
Yeah, Kevin, that's a great question. We, early on in the crisis, of course, all of our governmental stakeholders were saying, go home, stay home. And we had already actually transitioned about 60% of our workforce in the US to working from home. But what's obvious is there's, these things, these critical, especially maintenance tasks, couldn't be performed at home. And so we were sending folks, and continue to send folks into, as I said earlier, power plants, something not as obvious, into hospital areas because we provide absolutely vital building technologies for keeping those hospitals operating. And jobs like that ultimately, require an on-site presence. Well, key to all of that was changing the way we get there, making sure people could get to work sites safely. And so sometimes that meant switching them from group transportation into, more personal transportation. Once there, we had to make sure that they had adequate PPE. And we actually had some really tough conversations amongst the leadership team about if we were able to access PPE, where should it go? Obviously, first to those who are serving on the front lines. And then second, are there needs in our communities that are greater than our own needs in maybe some of our more safe workplaces? Should we be sharing PPE with local hospitals or local first-line responders that were absolutely have been needing their PPE? So all along the way, we've been making those very difficult calls about how to deploy resources to balance this real need of first keep our employees safe so they can continue to serve others, and then likewise serve the community. Now, what I'll tell you now is I hear a lot of talk, people actually, saying the words, I want to get back to normal. And the phrase I'm using right now is the now normal instead of the new normal, right? The whole idea that month by month, our perspectives are going to change. And what's important right now, for us right now, what we're saying to our employees is, if you can work from home, please do. I understand you're craving interaction with others, but we don't want to put undue stress on the system because we've got to leave the room for those who have to be out to be able to get out and do their jobs.
Really well said.
Kevin, I'd just like to follow up for one moment on that. We focused a great deal on the financial, access to financial. Jane talked about services and making it easy for people. I just want to stress that the financial is a small part. It's the human tragedy that is the big part and the long-term tail risk. Those young children, many of them minority children, from homes that don't have access to the same technology. Kevin, your children are going to school online. My grandchildren are going to school online, but not every child has the same access to technology. Young children, where early child care centers have been closed. Brain development in the first few years is so important. How many words they've learned is so important. And the most important time is 0 to 5, 0 to 6. What about those young kids that don't have the same experiences or access? Those people that have hypertension, obese, overweight, it normally sits in poor communities, minority communities. Centuries ago, Henry VIII and others, those that were the wealthiest were the heaviest. Today, those that are the poorest are often the heaviest because their food that they can afford might be nachos and cheese and not blueberries or raspberries from that standpoint. And so I think the cost of this human tragedy and the lack of development, we're going to need to figure out how not only to wrap up financially, but how we're going to make them get whole mentally as soon as possible. And lastly, when you spoke about ESG, what is the message today that young people believe in? and everyone else. And it's the same thing that I saw for the first time in the 1960s when the pictures were being sent back from Earth. There is no other place any of us can go that resembles this planet. Space travel is not available to us. There's a view that maybe there's a planet at the next star. Well, it's going to take 4 years just to get a picture back from the next star. And the new technologies that Yuri Milner's putting forth, it's going to take 20 years to get there, 20 years to prepare it. So there is no choice. We all live in a glass house. No matter what your wealth is, you are subject to this. Cancer has told us that 1 in 2 men, 1 in 3 women. But those at most at risk are from lower income, the poor, minorities.
Yep.
And it's not the risk today in the month of April and May. It's the risk of lost education for 3 months, lost opportunity, loss of hope. And so I think we all need to recognize that there will not be a good life for your children, my grandchildren, Kevin, unless every child feels they have a chance. And we're going to have to really respond to those that have suffered during this period of time.
Thank you, Mike. And I would like to reiterate that and to say that this is a divide that's based on economic circumstances, geographic circumstances. It's based on access to a variety of different resources. And that fundamentally for all of us, this is something that we have to keep in mind, that what we are adjusting, all of us here who are online right now, that we are the people who are privileged and lucky enough to be in this position where we can communicate, we can do our jobs, we can function. And it is up to us, both our wonderful panelists who've been great to join us here today, all of you who have joined us online, and those of us here at the Milken Institute, where we are looking at ways to address these issues going forward, to realize that if you're in rural Michigan, your entire second half of your school year for your kids is not going to count because not enough people have broadband or any other kind of remote learning access. If you realize that if you happen to be in an essential job with no help, with no child care, that you're fundamentally limited in terms of how your family works, your children are taken care of, and otherwise by all the limited resources, let alone the health challenges in this time. So thank you very much to our panelists for what is a very informative and engaged panel. We would like to encourage all of you to visit milkeninstitute.org to not only learn about what the Institute is doing in response to the pandemic and how to get involved, to look at our resources, including a COVID-19 treatment and vaccine tracker, access to all our previous weekly conference calls and ongoing podcast features, featuring our chairman, Mike Milken, which he referred to a few times during this conversation, an array of global thought leaders and more, and including our efforts, which among other things address issues in health, but also issues in small business and small and medium business lending, issues in terms of getting people back to work and for workforce challenges, issues in terms of philanthropy and corporate engagement. And we would love to be able to work with you to continue to address these issues, which will not go away when hopefully sometime soon we get vaccines and we get treatments to treat COVID-19. But ultimately, this new normal is something that requires all of us to work together. And I implore you to continue to work with us. And I'd like to thank very much Jane Fraser and Barbara Humpton and Mike Milken for an excellent conversation. And any of you who would like to get involved further, feel free to reach out to myself at Klowden at KKLOWDEN at milkeninstitute.org, to the milkeninstitute.org page. And we look forward to working with you further. And thank you very much.
Thanks, Kevin.
Thank you, Kevin. Thank you, Jane. Thank you, Barbara. Great
Thank
to
you,
be
Mike.
with